Welcome to Candesic in Conversation, a podcast series exploring the big innovations, opportunities, and challenges in health and social care, life sciences, and medtech. Today, Candesic is in conversation again with Leonid Shapiro, managing partner at Candesic, and we are talking about the Internet of Things. Welcome back to Candesic in Conversation.
Thank you.
Now, I guess we ought to say really, and most people will know, what the Internet of Things is because it's got a massive remit. So we are talking about the physical devices that are connected to the internet, allowing them to collect, to exchange, and to share data. Specifically in the case of healthcare, we're looking at everything from smartwatches to continuous glucose monitors for diabetics, fall detection systems, smart hospitals tracking assets, beds, and patients in real time, etc. And I'm interested to start off with a couple of questions. Why there is an appeal to investors, and then we'll go on to why it matters to patients, possibly the wrong order. But let's look at it from an investor perspective. Where is IoT currently delivering the most immediate operational return on investment?
So IoT, again, very exciting, potentially overhyped area in the past, really bringing some wins for operators. It's a very broad space. For example, in hospitals, it's being used to look at patient flow and throughput and beds in a real-time way. So it's about getting real-time information about when's a bed free, when's it been turned around, where the patient is at this moment in time, where is the specific piece of equipment that you need at this moment in time? Has it been clean? Is it broken? Is there an issue? All of that stuff historically is done on paper. It led to very long turnaround times for beds, lots of equipment being lost or not available when needed. So the hospital needed to buy more of the equipment in order to make sure that it was available than it actually needed. And nowadays, with real-time tracking, and this is everything from barcodes to RFIDs and just Bluetooth-based location base inside the hospital, the beds can be turned around faster, so more patients can be put into them. The hospital needs fewer assets, like pumps and things like that go by the patient bedside, so they can save on capital expenditure because they need fewer devices to deliver the same care, and they know where everything is at any one time with the dashboard, so they can identify issues and deal with them before they become bigger problems.
Sure.
Another area is around the workforce and also remote monitoring. So workforce nurses historically, for example, in care homes, even in hospitals, had to go in and take vitals of patients on a regular basis, check up on people and so on. Nowadays, with the Internet of Things and remote monitoring, those things can be done automatically. And they can be done constantly or continuously rather than every 2 hours or every 4 hours or every whatever. That does two things. One is reduces the amount of time that nurses and carers need to spend, but it also improves the frequency of updates so that you can identify issues earlier and improve quality. And the other thing is it's also moving care further away. So again, in the past, you had to have nurses and carers come to you, so you had to be in a care home or in a hospital. Now you can have these remote devices in your home, for example, monitoring the same way as they would if you were in a hospital.
Sure. And from a patient perspective, why does IoT matter to the patient? In what ways is it meaningfully improving the patient's lot?
Well, patients find it much more convenient. They don't necessarily want to be disturbed if a nurse has to come and check their vitals every 2 hours throughout the night. They'd rather sleep and have an automated system do that automatically. It's more convenient for them if they can be cared for at home. So virtual wards or just remote monitoring in the home enables patients to be let out of hospital sooner and get better care, higher quality care while they're at home.
And what about things like medication adherence? Presumably there are systems in place for IoT to do that as well.
Yeah, so adherence to treatment protocols is a big issue, particularly when a patient goes home, because they don't have the nurse coming in saying, it's time to take your medication. They have to take the medication themselves when they need to. So you can have Internet of Things type devices that track when you've taken your medication. They can even nudge you to remind you that you need to take this medication. and do a little bit of kind of like gamification to get you to walk that extra mile or whatever it is that you need to do that the doctor prescribed. And that does two things. One, of course, it improves adherence, so you get better outcomes, but it also gives the clinician looking after you more information because they can see if something's not working. They can actually see, is it really because it's the wrong drug, or is it just because the patient hasn't been taking it?
Sure. And you mentioned the data there. I mean, data and analytics is obviously huge here. We are gathering vast swathes of hopefully usable information. How do you get the most out of that data? What do you do with that kind of volume of clinical and operational data? How can you turn that into measurable outcomes?
Well, you have to data mine it. The amount of data that's created when you have something autonomously collect information is huge. And of course, again, we're shifting away from episodic collection of data to continuous collection of data, which means the data just explodes. The benefit of that is you have so much data that you can then do a lot of machine learning and AI and all that good stuff to mine that data to identify patterns that perhaps are not obvious to the naked eye or to an individual looking at the data. And that will lead to interventions that perhaps in the past were never done or never thought could be done.
Preventions as well. I mean, interventions, but preventions, because you can see these things coming before they happen.
Yeah, so the continuous nature of data collection from these remote sensors is that you could identify problems earlier in their life cycle and therefore intervene earlier to perhaps reduce the chance that that patient may need to be admitted to an emergency room, right? So that's one area. But in general, the more data you collect, the more information that the clinicians have to make some kind of interventions. And yes, they can make them earlier if they have the data earlier.
But that, of course, will raise its own questions in relation to governance, in relation to trust, in relation to interoperability, because there are all these devices speaking a different language. How do you see the future going forward in that area?
So this leads to a good discussion about which companies are going to be successful. We see a lot of point solutions out there. A lot of companies coming up with, I've got the better mousetrap, I've got a device that does this, or I've got a device that does that. Unfortunately, these devices don't necessarily talk to each other, and they're not based or built on the same governance and cybersecurity protocols that perhaps other systems demand, or that the...
And that suggests there may be winners and losers then?
Yes, of course. So the question is, you have a number of players in this space, and they're all adopting Internet of Things solutions. So you have some players that are coming from a hospital EHR perspective. So these are the systems that say run hospital health records and patient management, the clinical side of patient management, not the financial. They historically have collected data, but only in the hospital setting. But it's very easy for them to integrate with devices out there that collect data from the community or continuous data from the hospital as well. So the companies that are making point devices or point solution devices need to operate with the hospital systems, for example, in order for the benefit to come through. You also have service providers now that are outside of hospital that are delivering care through the use of Internet of Things. And these typically are more outsourced service providers that, for example, home care provider, where someone could look after you in your home with some remote monitoring that's not related to a hospital. Again, interoperability is key. You need to, whatever technology is deployed, it needs to talk to other systems, and it needs to do it in a way that's safe, secure, and governed. So in those, whatever you invest in has to have those basic principles, but someone's got to tie it all together into a service offer that's useful. I don't think that the companies that have a point solution, even if it's the best point solution, are going to be as successful as the ones that offer a generalized service, perhaps integrating the point solutions, but offering a broader service that creates value for everyone.
Well, one way to integrate things, of course, is M&A, consolidation.
Yeah.
Is this a consolidating market? And if so, who will the winners be?
It is increasingly a consolidating market. So you have some broader providers like Apple, with the health kits, and every Amazon's like doing their own thing. And there's all the large providers are trying to create an ecosystem and own the patient. But I think we'll see probably kind of two scenarios. One is the large integrated service providers, data providers. So it could be hospital EHR systems. It could be players like Apple that pull together lots of different sensors and try to create value from that. But it also might be a couple of point solution providers that just do something very, very well in an area like cardiology, for example, or another subspecialty. But increasingly, they're going to have to go much broader than just offering one solution to be successful. And perhaps the ones that are the best are that do a bit of both, that have offer a generalized relationship with the patient or the payer and a broader service, but have a really, really excellent sensor or device for a particular function that they use as a spearhead to get in, and then they offer the broader service by integrating perhaps competitor solutions into a solution for the patient or the payer.
And if I ask you to look into your crystal ball 5 years, 10 years hence, how do you see the market developing? How do you see IoT reshaping, if it's going to, the healthcare landscape over that kind of period?
So I think the real opportunity comes from being able to shift care from being episodic to being continuous. So this means that it's not just when you're sick, but when you're not sick, you can monitor your health and identify areas where you can intervene, or your doctor can intervene earlier in the process. And that's vital for these devices, these Internet of Things devices, to integrate with the clinical systems that monitor your health, either if you're in a hospital or if you're not, if you're under the care of your, say, GP over basically a long period of time to see how things are going and see how those data and the insights coming from those data can be turned into actions. Data just for the sake of data isn't useful. It needs to be integrated into the clinical pathway in a way that the clinicians are accepting of it to be helpful. So it can't be just, I've got a wearable, I'm going to connect it to my doctor, and the doctor is going to suddenly use it. It doesn't work that way. The doctor needs to believe that the data is that collected in a secure and governed way. The doctor needs to know that the data is actually insightful, so that it actually adds value to his or her clinical decision making, and is able to create value. It's important for payers as well. So payers don't want people to get more sick because they'll cost more in the long run. So if they intervene early, they can reduce the spend that they would normally have to spend if the patient was more sick. So using these devices to do things like risk stratification and avoiding unnecessary A&E visits, for example, by identifying things early and enabling the GP to deal with it rather than A&E doctors to deal with it, is a big thing for payers. And I think another really big area that we haven't touched upon where this can be used is in clinical trials, in actual drug development. So things like decentralized clinical trials where patients don't come into the hospital, they stay at home, but all the data is collected effectively in their home and in the community. That's now possible with Internet of Things. And this serves to reduce the cost of trials, and it speeds how quickly trials can be done, how quickly patients can be recruited, and eventually gets us our miracle drug to the market faster.
What are the biggest barriers then to adoption of this? Are we looking at technical, regulatory, cultural even issues here? What do healthcare operators, etc., face when adopting IoT solutions?
Well, interestingly enough, the technology isn't really the stumbling block. The technology isn't rocket science. I mean, true, there are more and cooler sensors out there that can do things at a distance that normally would need injections and things like that. But they're always coming up. But a lot of the basic technology has been around for years. It's just being implemented in healthcare now. Integration, as I mentioned, is key. The data has to flow to the right people in your care looking after you, that look after your care, to be able to use it properly. Otherwise, you're just collecting data for data's sake. It's the same thing as like I've got my watch here, I've got my
Indeed, yeah.
Aura ring here as well, and it collects data all the time, and it's all sitting on my phone. If I never check my phone to make any decisions about what I do with that data, what's the point of collecting the data? It's just there. So it needs to be integrated in the care pathway, and doctors, your GP, for example, needs to start using that and believe that that data is useful to their decision making.
How would you personally feel about that data being streamed not just to you, but to your doctor?
Well, I wouldn't mind, but obviously trust is very important. So who else has access to the data, under what circumstances?
Who owns it?
Well, I mean, don't get me started on the who owns the data thing with the NHS. That's a big one. But trust is important. It's just being able to know that, look, you trust already with if you have Apple or Google or whatever, because it goes to your phone, goes to the cloud. In theory, someone can look at it from the cloud, but people trust that Google and Apple are not going to somehow sell their data. But it's always possible. But trust is important. The other area is around regulatory and reimbursement. So what's allowed and not allowed, of course, that's getting easier, but it differs by country. So it's not as easy to develop something in one country and then spread it to another. But reimbursement is perhaps the strongest issue, because in many countries, doctors get incentivized to do some things, but not others. So they may get, from a clinical perspective, they may see that IoT device brings a lot of value to their decision-making for you as a patient. But if they don't get paid for it, particularly in America, they're not going to necessarily adopt it or incorporate it.
They may not want to have great swathes of data. They might not want that message to ping up that gives them the data that they then have to look at, because that's another raft of work for them to do as well.
I think doctors from a clinical perspective will take whatever data they can get if it helps care for the patient. But the reimbursement is an issue, because sometimes doctors get paid, for example, for doing a procedure because they're doing something. If that procedure was replaced with some data that came from an IoT device that they don't get paid for, they're less incentivized to adopt that. Right? And again, this is particularly a problem in America than in Europe, because of the difference in the way the healthcare systems are funded. But it's definitely a barrier to adoption.
And from an investor perspective, what does the company need to show here?
So if you're an investor and you're investing in an IoT company, there's a number of things that generally you want to see. One is you want to see the company actually have data that they have some kind of return on investment. So there's a benefit from their device. The doctors are using it to make a clinical decision that either saves money or improves quality. Right? If you don't have that, it's very hard to convince payers to pay for it. You have to have integration, and you have to have trust and kind of data governance. That's almost like a right to play. You have to have those two. You have to have some type of reimbursement mechanism. So direct or indirect, sometimes you get a code for that, using that device or that approach. Other times you don't get a code, but you kind of save money elsewhere. But there's got to be some benefit, financial benefit for the system or the clinician to use it. And then the last, of course, is evidence of adoption. Pilots are not enough. You need to actually see real adoption by clinicians in a broad sense, that not prompted through a pilot, but broad adoption, to know that there's a runway for growth.
Sure. And let's talk about innovation hotspots or the exciting elements to this. Which new developments are you most excited about? Which thematic areas within IoT healthcare? It could be hospital robots or smart beds or the medication adherence devices we talked about, continuous monitoring. What are the ones to watch?
So the hospital at home scenario is quite an interesting one. We know in the UK, for example, the Labour government is really pushing to take care out of hospital. IoT has a big role to play there. Being able to monitor patients in their home in a safe way will serve to reduce costs, improve quality, and actually improve convenience and satisfaction by the patient. So we'll see a lot more, I think, technology being deployed in patients' homes. the ability to continuously monitor and collect huge amounts of data, that's going to be that's going to benefit not only in making decisions earlier in the disease cycle to intervene earlier, but also create so much data that it can be analyzed through machine learning to bring insights that historically have never been able to be developed or brought out. You mentioned medical adherence, so devices that help you make sure you take your drugs, very important. And I think for hospitals, this concept of a smart hospital. So I mentioned about knowing exactly where your assets are at any one time, what state they're in, have they been turned around, cleaned, repaired. Those assets could be beds, they could be devices. Just having that kind of real-time dashboard allows the hospital to be run much more efficiently and in a smart way.
You're creating capacity out of nothing, out of what you already have.
Exactly.
Simply deploying it smarter.
Yes, you're using your existing infrastructure more effectively. And we could really do that now because, the NHS is promising to build all these new hospitals because it needs to, but it's doing that very slowly. So anything we can do to make the existing hospitals more efficient is definitely welcome. And then you mentioned robotics. There's two types of robotics in hospitals. There's the surgical robots like the Da Vinci. They're great, and there's a lot of opportunity for AI to potentially make a lot of the surgery almost automated, so to speak. But there's also the other type of robotics, which is moving things around the hospital. And a lot of American hospitals, when I visited Cleveland Clinic a while back, I saw in their basement they have the entire basement is full of these automated robots, basically factory robots that autonomously move materials around the hospital.
Sure, you've got automated robotic pharmacy dispensers in some countries now as well.
As well, yeah, for sure. So, that's going to just increase as time goes on.
And I think you've touched on this already, but who are the winners going to be here? So there are specialized players, remote cardiac monitoring, chronic care asset tracking, and there are broader platforms that are trying to bring these threads together and integrate multiple device types and data streams. You may not be able to pick a winner, but which of these is the horse to back?
So I mentioned that there are the generalist providers that try to more develop a relationship with the patient or the payer, but don't necessarily have a better mousetrap. And there are these point solution providers that have a really great tool, but it's very narrow in what it does and how it works. So those are kind of the two angles, and perhaps we'll see development of a bit of both, but it's the ones that, as I said, combine the two, where they have a very good point solution that they use as a spearhead to get in and to win, but they're offering a more broader relationship or value to the patient or the payer. So, for example, let's take Apple App Store, for example. Common example, but obviously they're not making all of the apps, but they're making a few apps that are very good, right? And of course, they have the whole phone and ecosystem to be able to deliver that technology to users. So that's the generalist approach. But then, of course, they're pulling in best-of-breed solutions from everywhere else. So it's important to...
We're back to your spearhead argument again, kind of, aren't we?
Yes. Yeah, it's important to have both, if you can. And also you think about hospitals and health systems. They don't want to have dozens of dashboards or dozens of implementations, some with different technology stacks and so on. They want to have one solution that's integrated, that's safe, that they buy once, one-stop shop, and all integrated together. And that's where things are going to go. Unfortunately, a lot of the EHR providers historically aren't that good at innovating new stuff. They, in fact, if anything, they try not to integrate. They try to do these walled gardens, keep other people out. So it may not be them that are necessarily the winners, but I think the innovative ones of those and organizations that bring a lot of things together and integrate them are the ones that are going to win.
I can see that the clock is ticking down as we bring this podcast to an end. If people want to get in touch with you, if they want to get in touch with Candesic specifically, I will be leaving a link at the usual blurb, but what's the best way to get in touch with you?
Please feel free to call me or email me. We've done a lot of work in this area, both in hospital and non-hospital care, and technology and AI. Very happy, always happy to talk about this with investors, providers, startups. It's an exciting space.
Fantastic. Thank you for your time. And thank you to everyone who listened all the way to the end of this podcast. My name is David Farbrother, and I am Director of Content and Communications at Candesic. We are a London-based consultancy. Feel free to link in with me or drop me an email. I would love to hear from you. New podcasts in this series are available regularly on YouTube, Amazon Music, Apple Podcasts, and Spotify.